Hi. Has the thought of putting your anxious dog on medication become dilemma? On one hand, you feel that medication would really, really help. On the other hand, you worry about side effects. So what I'd like to tell you in this video is that sometimes or some dogs have such a severe separation anxiety problem that medication is a must. It's the only thing that will help together with behavior modification. In other words, medication should be regarded as a way of helping your dog. It's a way of bringing the anxiety levels down a bit, but medication by itself is not what will solve your dog's separation anxiety. So in this video, I'm going to share with you why medication is important in many cases and what precautions you should take to ensure that everything goes well. So when anxiety is severe, your dog's brain can't learn anything. It becomes unable to learn anything. This means that they can't learn to become emotionally independent from you. They can't learn to feel safe when you're not there. They basically can't learn anything. Now, it's got nothing to do with intelligence or lack of it. It's got to do with anxiety being so high that the brain can't function at all in any other way. So the role of medication is to actually make your dog more receptive to learning and to behavior modification. So don't look at medication as the solution. Think of it as a crutch, a temporary crutch, but it shouldn't be regarded as something that your dog must do for the rest of their life. And it shouldn't be regarded as the total solution. Like I said, think of it as having a really bad headache. So you want to get rid of the headache, but you also want to get rid of what's causing the headache. So you take a painkiller to get rid of the headache, and then you work on what's causing the headache. Okay, so dealing with your dog separation anxiety is very similar. So no dog trainer or dog behavior consultant like me should, and they can't, prescribe medication. They can, however, suggest that you take your dog to a vet because you feel, or they feel, that your dog will really benefit from medication. It will be like a real great essential help. But no, nobody should, or you shouldn't listen to anybody who says, oh, I'm giving my dog such and such, so try it. Don't do that because every dog's organism is different. Your dog's health needs to be assessed before medication is given. So many vets will do like blood work and to make sure that the kidneys are functioning properly, the liver is functioning properly, and they'll do all that and just basically a general checkup to ensure your dog is healthy before giving medication. So don't borrow somebody else's medication. It can really go wrong for your dog. Don't buy any over-the-counter thing. Don't try even the more natural alternatives unless you talk to a professional who knows the product really well. So the best, when I'm talking about medication, I am talking about anti-anxiety medication, not natural alternatives. So ideally, you should consult with a veterinary behaviorist because they can assess for the problem, they can decide which is the best medication, and they can prescribe it. If not, then the usual vet that you consult, you can tell them, look, what you think about my dog being put on medication because anxiety is out of control. So no matter how the speech goes, but your vet will do the physical and the blood work to ensure that your dog is healthy, and they will prescribe medication. So those are the only two professionals, a vet and a vet behaviorist, who are qualified to prescribe medication. That's number one, very important point. Then there are, depending on the medication, there are some drugs, so to speak, that take a while for you to see an effect. Some of them can take up to 4 weeks before you start seeing any kind of result. So don't stop giving your dog the medication just because it looks to you like it's not working. You need to give it enough time to work. Also, some medications can make the problem worse in the beginning before making it better. And that's why many vets opt for starting with a low dosage and then gradually increasing it to the right dosage, which is often calculated according to your dog's body weight. So, medication does, in order to help your dog, it obviously has to impact his brain or their brain chemistry. And so, it's very important that you never run out of it or that you never skip doses. Sometimes we might think, oh, I forgot to give them the tablet at breakfast. Never mind, I'll give it later on. And that can result in what is called rebound anxiety. So your body, your dog's organism is used to the medication. And so if you miss just giving it to them once, that is enough for the body to go into a kind of withdrawal and for anxiety to rise. So number one, only the vet should prescribe medication. Number two, follow their instructions strictly. Expect not to see immediate results. Don't give up, okay, if you don't see immediate results. Do keep in touch, and especially if it's the kind of medication that requires the dosage being adjusted, keep in touch with your vet also if you find something abnormal, because it may be necessary to adjust the dosage according to your dog's behavior. Okay, don't skip, don't do that, because so when I say don't skip, I also mean don't run out of medication, because their organism can go into withdrawal quite soon, and the anxiety can become worse. And then eventually it should also be up to your vet to decide when to start gradually weaning your dog off the medication. It is very rare that a dog with anxiety needs to be on medication for the rest of their lives. In most cases, there is a combination of medication and behavior modification, and so the dog starts being weaned off the medication once real improvement starts being observed. But it should also be up to the vet to tell you how to wean your dog off. If you stop giving medication abruptly, anxiety can just shoot up. Not because the problem came back, but because of withdrawal symptoms. So, in short, medication does help. In my opinion, it's a must in many cases, but it has to be given to your dog with care, with control, with structure. Please don't feel tempted to try and purchase something because somebody else is giving it to their dog and it's really helping them, because what works for one dog might not work for another dog. I hope you found this video helpful. And if you did, just go down, click the button to subscribe, and you'll be able to watch a bunch more videos. All our videos address anxiety or separation anxiety. And so we're here to give you information and tips. Take care.